I was diagnosed with breast cancer in May of 1997. It was advanced because I'd felt a lump probably a year earlier than that. I've never been sick before, so it didn't scare me as bad as it probably should have. Dr. Commerce and Dr. Verdirame, they were a team, and you just always felt like you were in the best care that you could be in, and you didn't have to worry about it. You didn't have to worry about what was going on because you knew they were doing everything they could for you. And they do that for every patient, it's not just me. They're an amazing bunch of people, that's for sure.
This is their legacy. That's how I look at it. This is the practice they started and they entrusted us with it. So this is their legacy and we want to do them proud.
There's a lot of great places to receive cancer care in Omaha. We're happy to have been involved in this particular one. Joe's a real student and he's always been a student. He and I sort of have different skill sets and they're complementary to one another. You know, we worked together enough years so that in terms of medical therapy, he'd know what was in my head and I knew what was in his head. And so we were able to give people a unified answer to their questions, a unified approach to their therapy.
Ernie, he's the salt of the earth. He really is, and his patients love him, and I'm very envious. He will sit down and talk with his patients for hours on end about farming, hunting, fishing, talking about their kids and where their kids are going to school. I mean, patients just love them. We did do a couple of things that were first for Omaha and for Nebraska. We actually performed the first bone marrow transplant in the state in 1982. We started a cancer support team. Nowadays, that's common practice, but back then, it was not common to recognize that patients with cancer didn't just deal with their medical problems, they were dealing with other issues as well.
Throughout our careers, we'd always had a presence here at Immanuel, and the hospital was more than gracious to allow us to design and then build a cancer center, not just for our services, but for radiation oncology as well, and for all those support services. It's a very comfortable place to work. I think it's an equally comfortable place for patients to receive care, just the nature of the way the place has evolved.
That gives me more pride than anything. Just knowing that our group over the years, for 35, now 40 years, has had an excellent reputation for patient care.
Without Dr. Verdirame and Commerce, there would be no cancer center at Immanuel. They are the ones that established the cancer center here, but more importantly, they had the vision and foresight, okay, to make sure that the cancer center model would be one that works for everybody.
When I came here, the difference I saw was that these doctors put patients first. It was all about getting the patient what they needed, and we all felt that as staff that worked with them, and so we all wanted to do that too. It was like the driving force. It made us all want to be better and want to do better for patients.
For both of them, what they taught me in oncology was tremendous. I learned so much from them about the science behind oncology and what it meant in terms of taking care of patients from a medical standpoint. They've built a legacy here in terms of cancer care and continue to have a multidisciplinary team taking care of patients here with great physicians, great medical oncologists.
I could not have asked for better friends or better mentors. If there's anything that I would say to both of them, it's this: your shoes are impossible to fill. We miss you guys. And you guys are great, great, great people. And I wouldn't change anything. I wouldn't change anything. And those of people who know me know that I'm not a man of many words. And so, Joe and Ernie, thank you.
It was a pleasure to work with both my medical partners, but with all my other various partners in oncology care. So I probably would say that was one of the things that I enjoyed the most.
It's a great thing, and I'm glad I'm getting the award with Ernie. I mean, we've been tied together at the hip for a long, long time, and I'm glad we're receiving it together.
They saved my life. I think they're amazing. I think they do amazing work there. They care. They really care. They care about They cared about me, not just my health, but my mental stability. They cared about how I was doing every day. I can't thank them enough for the life I've gone on to lead and being able to go on and lead that life because of what they did for me.